Hello, I'm Dr. Susie Weber. I'm a board certified gynecologist and menopause specialist. Today's video is going to be about my experience with Cushing's disease. It's not directly related to perimenopause or menopause, but all of the symptoms can mimic some of the things that women will experience when they're in perimenopause or menopause. And initially, that's what I thought was happening with my body. It was just perimenopausal things. And I found out that I actually have Cushing's disease and have recently had surgery for that about 2 weeks ago, which is why I sound like I have a cold from surgery. So it's also the reason why I've been missing in action. I haven't been blogging a lot. I haven't been recording a lot of videos because I've been getting a lot of medical tests and just from the Cushing's disease have had a lot of other things going on. And so I just really wanted to present this topic today. Sounds like I'm a teacher and there's going to be a quiz. There's no quiz. I just hope that I can present information that can help somebody out there or maybe help a medical provider recognize signs and symptoms of Cushing's disease. Cushing's disease is a medical condition where an individual's body makes too much cortisol. Cortisol is a stress hormone and it impacts your body and your mind. It impacts you emotionally and physically, and it can absolutely destroy your body if it's left untreated for a long time. And unfortunately, a lot of the signs and symptoms are so non-specific that so many people are not diagnosed for years or even decades with this disorder until they are just absolutely wrecked physically and emotionally. I feel fortunate that mine was found kind of incidentally. I mean, I was having a lot of perimenopausal symptoms. That's what I thought it was. I was skipping menstrual periods, but hey, I was almost 50 years old. I had a lot of increasing anxiety, insomnia. I would wake up at 2 or 3 in the morning. I'd be unable to get back to bed. I had some weight gain, about 20 pounds over a few years, which is not a ton. And certainly, as we age or we become less active, that can happen. But I just kept thinking I need to eat less. I need to move more. I need to try all these relaxation techniques. But my symptoms kept getting worse. I also have had a lot of hair loss. My hair has changed texture. It's curly, it's frizzy. Maybe a few extra chin hairs. Some people certainly can have more hair growth. They can have acne. They can have extreme weight gain, 50 to 100 pounds, and they can have that in a short period of time. They can also get a fat deposit on the back of their neck, which is called a buffalo hump. Trying to think other symptoms that I had, maybe brain fog. Again, common to hear that around perimenopause. I see so many women in my practice that have this laundry list of a lot of these symptoms, and that's what I thought I had. And then there are late complications that can arise from having untreated Cushing's disease because it can impact your bone density. So a lot of people present with osteoporosis and fractures. I broke a bone in my foot just walking down the street with my dog. You can have high blood pressure. All of a sudden I had blood pressure through the roof, 180 over 110. I had to go on blood pressure medications. A lot of individuals can develop prediabetes, which is what I was moving towards, and can also have just frank diabetes. And, when most docs are trained in medical school, we learn about Cushing's disease or Cushing's syndrome. Cushing's syndrome is the larger umbrella that applies to all of the causes of extra cortisol in our body, which can also include things like tumors or growths on the adrenal glands, or medications, long-term high-dose steroids, or also, there are other rare causes of this as well. But we're taught to look for people that are very obese, with a lot of weight gain in their center area, their belly hanging down, a lot of truncal obesity, stretch marks, easy bruising, that buffalo hump I talked about. So these are probably all very late findings. And there are so many people out there who do not present with these classical signs and symptoms. And so they may present with their doctor, to their doctor with some menstrual irregularities and some weight gain and some extra hair growth, and maybe they're told that they have PCOS or polycystic ovarian syndrome. There can also be other people that come in with symptoms of weight gain and new onset diabetes, and they just have the routine blood work done. They get their thyroid checked, they get their blood count, they get their chemistries, their blood sugars, but nobody looks at their adrenal hormones to see if there's something else going on. And so today I'm really going to focus on my experience with Cushing's disease, which is hypercortisolism or extra cortisol in our bodies that comes from a growth on the pituitary gland called an adenoma. And pituitary adenomas cause 70% of Cushing's syndrome. So, and even then it's considered rare. So it's quoted about 10 individuals out of a million will have Cushing's disease. I think, as do I think probably a lot of people that have Cushing's, that it's just underreported and it's underdiagnosed and we're not finding it. Other things I didn't mention that were sort of subtle symptoms that I was having is swollen upper eyelids. They'd get really swollen at the end of the day, or if I had salty food, I also would have random flushing, face flushing, and I would just profusely sweat. So even silly little things, getting up in the morning, having half a cup of coffee, I would be pitting out with sweat, or taking my kids to school or driving to work. Any little thing like that would really cause me to sweat profusely. And my symptoms were worse in the morning because cortisol follows a diurnal pattern. And what that means is that in the morning, before you wake, your body ramps up its production of cortisol to get you awake and stimulated. And then as the day goes on, the levels drop, and they're usually lowest around 11 o'clock to midnight. So in general, my story was that I was experiencing night sweats and insomnia and anxiety. I'd wake up at 2, 3 in the morning. I couldn't get back to sleep. I would be sweaty. I had a lot of increasing anxiety. Some subtle weight gain despite trying to be healthy and working out and lifting weights and doing all of those things. I would be really revved up in the mornings. I would just feel manic. I had all this energy, and then basically I would kind of crash at the end of the day. I would have no problem going to sleep. I would just be really tired. I also had some increasing exercise intolerance. I couldn't do the things I used to do. And then, I'm perimenopausal. I wasn't having a period. I didn't really think anything about it. And I thought that a lot of these symptoms were perimenopause. So I got myself on some hormones. I got on some estradiol. I got on progesterone. Symptoms probably started about 3 years ago, and they just started, and they were getting worse and ramping up, and the hormones really weren't helping. I didn't think about Cushing's. All of my blood work was normal. My blood sugars, my thyroid, all of that stuff looked fine. I did have some menopausal hormones drawn, FSH and estradiol FSH, which is a pituitary hormone. It drives our ovaries. That was mildly elevated. Estrogen levels, those things aren't really very helpful because when we're in perimenopause, they can fluctuate pretty wildly. So we don't always use them, obviously for a diagnosis. But I went to my provider and I was just like, I need something. Maybe I should try testosterone. I have a lot of my patients, well, maybe not a lot, but I have some patients on testosterone who feels like it helps with their fatigue, their anxiety, their brain fog, their sleep. And, there have been small studies. There was a small study done in the UK where they looked at adding testosterone to menopausal hormone therapy with estrogen and progesterone, and they found that it did help with those parameters in some women. But we don't really have a lot of studies to look at testosterone. We don't really have many, if at all, any other studies that look at testosterone and how women feel with regards to energy. It's really related to libido that we have that data. So I said, look, I just need to try something. So she sent a testosterone level and a free testosterone level, and my total testosterone level was normal, and the free testosterone level was pretty elevated. And really it's that lab that probably, I don't want to say it saved my life, but it saved my quality of life, and it definitely saved me from what probably would have been years of seeing people trying to get a diagnosis. Sorry, because I'm on these Facebook pages with other people that have been to providers for years and decades, and just nobody listens to them and nobody really thinks about this because it is rare. Or they might test one thing and say, oh, it's normal, but there are a lot of people out there that have Cushing's disease that don't have every single lab test that's abnormal. And some people have cycles in their cortisol too, and so they may be having periods where they're in a normal range and then periods when they're in an abnormal range, and it's a booger. I am not an endocrinologist and I'm not a Cushing's expert. I'm just talking about what I've been through and what I've seen, but it can be really hard to diagnose. So my free testosterone was elevated, and that got reflexed to an adrenal hormone, which was elevated, and off I went to the endocrinologist, and I was fortunate to get in within a month or so. Probably could have gotten in sooner, but it was the holidays and we had other family stuff going on. And then I saw her and I did evaluation for Cushing's disease, which involved doing a 24-hour urine cortisol, salivary cortisol levels at 11 o'clock midnight. The urine cortisol, I mentioned that. I also did a dexamethasone suppression test, and everything was coming up abnormal. It was kind of funny because when I did the dexamethasone suppression test, this is a test that you do where they give you a dose of steroids to take at bedtime around 11 o'clock midnight, and it's supposed to suppress your cortisol. Well, if you have a tumor in your pituitary that is producing a hormone to make your body release cortisol, that's not going to suppress from the steroid. So I remember that the cortisol level came back first, and my endocrinologist messaged me that, oh, I assume you didn't take the dexamethasone. And I was like, girl, I took that dexamethasone. I think she was even shocked because she just expected that I wouldn't have Cushing's because I wasn't fitting the stereotypical picture of Cushing's. So anyway, I got the diagnosis. I went and did a pituitary MRI. And these pituitary growths can be so small that you sometimes can't see them on MRI. They are literally millimeters. The pituitary gland itself sits behind your eyes at the base of your skull, and so it can be kind of hard to see. So you have to have a special type of MRI where they can do lots of serial sections. My initial MRI was done at a community radiology place that everybody in town uses. And it was read as no adenoma. And there was a little bit of a deviation of the stalk or the little growth that the pituitary, comes out pouches from, or the main part of the gland. But it wasn't a normal MRI, but they didn't see an adenoma. So I was referred to a pituitary program in the state that I live in, and I'm so fortunate to have that here. So I really didn't have to travel very far. And the moment the endocrinologist looked at it, she said, I think that there's a tumor right here in the right side of your pituitary gland. She could see a bulbous area, kind of an outpouching, irregular area. And then when she showed it to me, I could see it too. So, I think that that's another barrier to diagnosis is people get MRIs, and the radiologist, even if they're neurotrained, which apparently at this place where I had mine, all of the radiologists are trained in neuro stuff like pituitary tumors. They didn't really report on that at all. My neurosurgeon looked at it. He said the same thing. So before they scheduled me for surgery, they wanted to make sure that there was something there before they subjected me to this invasive surgery. So I had a procedure called an IPSS, which is an inferior petrosal sinus sampling, which is a procedure where a radiologist goes in through the veins in your groin. They snake these catheters and guide wires up to the venous sinuses around the pituitary gland, one on the right side, one on the left side, and then they measure how your pituitary responds to different medications that they give you. Anyway, I don't want to belabor the point on that, but it's kind of an interesting procedure. But mine was positive as well. And I had excessive ACTH levels or hormone levels coming from the right side of my pituitary. So I was scheduled for surgery, which I had about 10 days ago or 11 days ago. At the surgery, what they do is they go in through your nose, through your sinuses, and they access the pituitary gland by removing a little bit of the skull that sits below the base of the pituitary. And they remove the tumor. And sometimes it's clear cut. They know where the tumor is. They can find it. Other times they may not find a tumor, or if they have high suspicion that there's a pituitary tumor, but they can't see anything on MRI, they may still go in there and remove parts of the pituitary gland. And it's what I was told is that most of the pituitary adenomas actually are in the periphery or the outer edge of the pituitary gland. So a lot of times they may remove part of the right side, left side, top. Everybody's diagnosis and surgery is going to look different. My surgery went well. I had another MRI that morning before my surgery where they thought they did see a right-sided pituitary adenoma measuring about 6 millimeters. So if you're trying to put that into inches, that's basically like 1/4 of an inch. So this is a very, small growth that can wreak so much havoc. It pumps out ACTH, that stimulates your adrenal glands to pump out cortisol. And, just as an aside, the pituitary is called the master gland because all these things come from the pituitary. Your ACTH, which regulates your adrenal hormones, your stress response, your blood pressure, your blood sugar. It also produces your, sex hormones. It makes FSH and LH, which drive your ovaries. It also drives, sperm production. I'm not going to talk about men because I'm a gynecologist. I don't really know much about that stuff anymore. Your thyroid, same thing. So it's really crazy how much this gland controls. And you can have other types of pituitary hormones that do not make ACTH and produce cortisol. In fact, the minority of tumors in the pituitary gland, I think I read about 10 to 15%, are actually are Cushing's disease. So the majority are going to be something else. Anyway, my surgery went well. It was a few hours. They were able to see the tumor. They were able to remove it and remove some extra tissue, which appeared to be clear of tumor cells. It wasn't invading to any surrounding structures. So that's an alarm with these types of tumors, not just in Cushing's disease, but other types of pituitary tumors. You don't have a lot of symptoms if they're not making hormones. Those are called non-functioning pituitary tumors. And if they're not making hormones, you don't get any other tip-off. They can just grow and grow and spread, and they sit basically behind your eyes in your brain, and they can get very close to the carotid arteries and blood vessels. They can also push on the nerves that go to your eyes, so they can affect your vision. So it's really crazy. Anyway, so I after surgeries, things went well. People that have the surgery, they go to the ICU. I went to the ICU, or the neurointensive care unit, overnight, and I was feeling pretty good. The next day I was just using Tylenol and an ice pack to control the headache and things like that. And basically after that surgery in Cushing's disease, they watch for your cortisol levels to drop. That can be sometimes a prognostic thing to say, hey, it looks like we got it because your cortisol levels dropped precipitously. And in our institution, they wanted to see cortisol under 2 grams per liter. I forget what units on there. Times 2 in a row. So they're checking my cortisol every 6 hours. And then I would have a low, I'd be at 2, and then the next one would be at 8. And so mine was kind of doing this. So instead of getting out of the ICU the next day, I was there for a couple more nights, basically going through some of the adrenal insufficiency things. Because what happens is, when your pituitary gland is operated on, it's stunned. And so this little tumor had been pumping out ACTH, driving my cortisol production. The rest of the pituitary gland had kind of gone to sleep. So what they need to do now is basically wait for the rest of the pituitary to sort of wake up, start making the ACTH so that I can get a normal cortisol level back. And it was a few days and my levels were doing this. In the meantime, they were keeping a close eye on me, and I had some side effects, like I was really tired and weak and just nauseated. I had some vomiting, just really felt like garbage. The surgery was no problem. It was just all of this metabolic stuff on top of it. And, frankly, I was pissed because this place had a good menu. They had all these things on the menu I wanted to eat, and I couldn't eat anything because people that know me, you guys, if you know me, I don't miss a meal, and I like good food. So I didn't really get to partake in that, but whatever. That's kind of a minor thing, obviously. I should just be happy things went well if I didn't get to eat that breakfast burrito. So finally, by the end of the third day, I got 2 levels that were low. And frankly, at that point, endocrinology had said, look, if you get another one that's low, even if it's not below 2, we're going to start you on prednisone. So on, 3 days after surgery, that evening, they started me on prednisone. Bam. After that, it was like a magic for me. It was magic. I felt great. I got to go to a regular room the next morning. I was up and at 'em. I had a better appetite, and I got to go home. So that has been my journey so far, and now I'm just taking prednisone daily. A couple days I'm going to start trying to wean off of it. I understand it can be months. It might be slow going. It might take a while, but that's okay. I'm just going to put one step in front of the other. So I hope that my description has helped somebody, and I left things kind of vague because, again, not everybody's going to have the same symptoms as me, same surgical outcome, but I just wanted to present mine because, again, I want to promote awareness. And it's kind of embarrassing. I don't know, I guess I'm not embarrassed. I don't really get that embarrassed, but that I'm a menopause specialist, and like I said, these symptoms overlap. I mean, if you're a perimenopausal, you don't have these symptoms, you're lucky. But maybe who doesn't get a little bit of a belly? You gain some weight slowly. I hear this all day long from my patients. I can't sleep. It's that waking up in the middle of the night, in the morning, you can't get back to sleep. You got hot flushes, you got night sweats. So all these things, yeah, they probably are perimenopause, or they can be menopause. And there are a lot of menopause gurus out there say, well, if you're between 45 and 55 and you're not having periods and you have these symptoms, it's just menopause and I don't need to check these hormones, et cetera, et cetera. But, I think there is a role for checking things. I never had hormones in the menopausal range, and all of my normal labs like thyroid, et cetera, were normal. So I think, especially in mid-age, we still have to have a fairly high level of suspicion. Yeah, I just diagnosed someone the other day with hypothyroidism. She had a TSH of 11, which normals between 1 and 3. That could be contributing to weight gain and brain fog and fatigue and all of those things. So we just can't chalk everything up to, it's just perimenopause. It's just your anxiety is getting worse. We have to look at each individual as a person. And this experience has been really enlightening to me. And, I just wanted to share it, and also to promote awareness that Cushing's disease, Cushing's syndrome, these things are out there. And I see people that are being missed in my support groups, etc. And as medical providers, just another thing to keep in the back of our mind. Thanks.